So, welcome everybody. This is our fourth Horse Owner Education Committee webinar of 2025. The last one for this year. We look forward to bringing you some more next year. And hey, if you have any recommendations for topics for a webinar, let us know. Stick them in chat. I will give you my email address in a little bit. We would love to hear your requests. But anyway, this is a horse owner educational webinar from the American Association of Equine Practitioners. We call ourselves the AAEP. We are very excited to have you here tonight. My name is Karen Pouts. I'm the Director of Education for the AAEP, and I'll be the moderator for this session. Now, the American Association of Equine Practitioners is the world's largest professional membership association for equine veterinarians and veterinary students. And there's a good chance that your personal vet is an AAEP member. One of the AAEP's primary missions is to deliver the latest treatments and research in equine veterinary medicine to our vet members. But this mission extends to providing quality information about the health and welfare of the horse to the clients of our member vets. And that's why we have you here tonight. And we very much appreciate your commitment to your horse by being here with us tonight. This webinar is entitled Care and Management of the Elderly Equine. Our panelist experts on this subject are Doctors Allie, Catalino and Ashley Pfeifer. Now, once we get started, I'll let them introduce themselves a little further. But first, again, quick bit of housekeeping. First, please understand that we're not able to answer questions specific to your individual horses. You need to save those questions for your personal veterinarian. However, we do want you to take advantage of the interactive nature of this webinar and chime in with your questions and your comments using the Q&A box for questions and the chat box for chatting. And also don't forget those reactions. We'll try to get to as many of your questions as possible. Those of you who sent in questions ahead of time in the registration form, a lot of those answers have been integrated into the presentation. And then we'll have a little time at the end to answer some more questions. Quick shout out to Kevin Hinchman. He's our IT director, and you can't see him, but he's hanging out behind the curtain in case we have any technical difficulties. We're also hoping that Dr. Catalino doesn't blow away tonight. Her area is being a little difficult. So if she blinks out of existence, we'll just hope that she can come back. But I feel all right about it, Dr. Catalino. You're going to be able to hang right in there. So, oh, and of course, this will be recorded, and the on-demand recording will be available to you after the fact. You'll get an email telling you how to find that video. So I think with that, I'm going to turn over our microphone to Dr. Pfeifer, and we'll go ahead and get started from there. Don't forget to unmute yourself, Dr. Pfeifer. Perfect.
Thank you, Karen. I'm Dr. Ashley Pfeifer. I practice in Southeast Michigan, and I am really excited about this topic. I have been a veterinarian since 2019, graduated from Purdue University, and moved up to Michigan right after, and started at the same practice I've been at the last 6.5 years. And I really enjoy caring for the oldies and doing dental work, preventative care, and pain management. So I'm looking forward to this discussion with you all. And then
Thank you, Dr. Pfeifer. I have a very similar intro. I'm Dr. Allie Catalino. I am practicing in upstate New York. I graduated vet school in 2018, so around the same time as Dr. Pfeifer, from the Atlantic Veterinary College in Canada. When I was done with veterinary school, I jumped right back down to where I'm from, upstate New York. I did my internship here at a large equine ambulatory practice, and I stuck around. They couldn't get rid of me, so here I am. I also have a love of the oldies. I grew up riding some lesson horses, and I could not have learned the things that I know without those 35-year-old goodies that we had. So I really enjoy managing these patients well into their old age, and I hope that we can give you guys some information on how to do that a little bit better tonight. So without holding off, I think we should go ahead and get started. Let's see, I'm on my phone because of technical difficulties. Is the screen share happening? Karen?
You look good, Dr. Catalino.
We're good, it's there?
Yeah, sorry.
Okay, perfect. So we can jump to the next screen.
Okay, hang on just a second. It is being a little, oh, I know exactly why it's being a little difficult. Just a moment, you guys. There, now we're good to go. Okay.
Okay, so we can go ahead to the slide with the program outline. Perfect, and I can see it, which is a feat in and of itself on the phone. So this is our outline for what we're going to be talking about tonight. We're going to start with the average lifespan of the horse and some general information on how to care for them. Because it is November and we're headed into the winter months, whatever winter is for your geographical location, we'll discuss a little bit about how to support these guys through the upcoming weather. And then we'll go into some common ailments of these old guys and what we can do to treat them through those processes, as well as equine dentistry and what happens with their teeth as they age. Lastly, we'll have a short discussion on quality of life assessment, which nobody wants to talk about, but it's good to be prepared before we open up the floor for some questions. So of course, if you have questions as we go, pop them in the Q&A, but I'm going to go ahead and get started here. So thank you, Karen. I'm switching through the slides on my computer, and I'm going to have to try and remember to ask you to swap to the next slide as well. So the lifespan of these guys varies greatly. It can be anywhere between 25 and 40 years. Yes, 40 years. I saw somebody pop on there with a 44-year-old horse. I mean, we're just able to take such good care of these creatures now. They're living much longer than they used to. Certainly the smaller ones live a little bit longer. The smaller spicy ones live a little bit longer than the older low-key guys. I populated my slides with some of my favorite patients. So on the bottom left here is Fang. He's a 38-year-old. He has Cushing's and is that's managed well with his owner who's pictured. He's barefoot and lives on free choice chopped forage and senior feed, and he is just living his best life. I think he turns 39 in a couple months. In the middle there is myself with Legacy, a 40-year-old. He'll be 41 also in 2 months. He has Cushing's, it's well managed. You can see his fuzzy coat in that picture. He has a set of shoes, but lives on a soupy diet because he has a history of choke. Otherwise, he is 40, almost 41 and thriving. In the upper right-hand corner, that's Miss Mandy. I just saw her this week as well. She's 41 years old, going on 42. She's a spicy little old lady. She is managed with multiple small meals per day so that she doesn't get sick of the food in front of her. We monitor her lab work regularly to check her kidney and liver function because she's had some trouble with that in the past. But other than that, she lives her best life with the occasional acupuncture session. One thing to note, we're not allowed to do acupuncture on her too regularly because she gets a little too spicy and runs through the fence. That's not a joke. Go ahead and switch to the next slide, Karen. So jumping right into general health care, it's pretty similar to taking care of these creatures in their younger years, but it's almost more important because their immune system starts to have a lot of wear and tear as well as their GI tract. So we need to support them even better than we did when they were 10 to 15 years old. What that means is a strategic deworming protocol. I say strategic because gone are the days that we deworm every other month with whatever product is listed out on kind of a every other month protocol. We are going to deworm based on our patient's individual needs. That's going to be guided by a fecal egg count, which you should probably be doing 1 or 2 a year through the guidance of your veterinarian. They will help you with those results, keeping in mind that fecal egg counts don't necessarily give you a really good idea of exactly what's going on in the gut, but if you keep doing them, you know, every 1 or once to twice every year, you'll get a really good idea of kind of what their worm burden is and what deworming strategy you need to do. Your veterinarian is also going to help you through the fact that we're starting to see some resistance to popular dewormers like ivermectin. So if your fecal egg count on your horses continues to rise despite deworming, they might change the protocol for you. Different ways to manage parasites in your herd in addition to deworming include removing fecal material from stalls and pastures. You know, your horses are shedding the fecal eggs, or sorry, the parasite eggs. And if we leave them in the environment, they're going to re-ingest them and it's going to continue the life cycle. So if we can halt the life cycle, we can reduce their worm burden. A similar way to do this would be rotating pastures with other species, which will also interrupt the life cycle of the parasites. It's recommended to house horses together of similar age and immune status so that we can care for their parasite burden based on a cohort rather than an individual setting. You might also use an elevated feeder rather than feeding off the ground so they're not eating literally right where they poop. And remember to remove bot eggs when you see them on your horse's legs. Next slide, please. Vaccines are very important in our old horses, potentially even more important than they are in our youngins. I only say that they're more important because people tend to think that their old horses have an immune system that is well primed from years and years of vaccinations. It's important to note that that's not the case. They need to continue with their yearly vaccines. I was recently on the phone with the diagnostics lab about a West Nile virus case that I sent in, and she said that the majority of the positive West Nile virus cases that they see in New York are actually elderly horses where the owners had vaccinated yearly up until a certain point and then decided to stop vaccinating. Then their horses contracted West Nile virus because they no longer had the appropriate immune response from their vaccines that had lapsed by 5 years. So the AAEP defines core vaccines as those that protect against disease that are endemic to a region, are virulent or highly contagious, pose a risk of severe disease, those having potential public health significance to humans, and or are required by law. Core vaccines have clearly demonstrable efficacy and safety with a high enough level of patient benefit and low risk level to justify their use in all of our equid patients. The core vaccines are listed here on the slide as rabies, the encephalitides EEE and WEE, as well as West Nile virus and tetanus. Next slide, please. There is a whole long list of other vaccines that are available. These are considered to be risk-based vaccines, which defined by the AAEP are those which are selected for use based on risk assessment performed or in consultation with your veterinarian. Use of these vaccines may vary between individuals, populations, or geographic regions. Some of the most common ones that I talk to clients about are listed here: botulism, equine herpes virus, equine influenza, leptospirosis, Potomac horse fever, and strangles. But this is not an exhaustive list. There are more vaccines than that. So definitely talk to your veterinarian about what they recommend for your oldie as they transition. Next slide, please. It is important to check lab work on these guys pretty regularly. I think that this is widely underutilized in our equine patients as compared to our canine and feline patients. Pretty regularly when I'm at the vet with my dog, they recommend blood work, but I think that we've kind of fallen into just doing vaccines yearly on our horses and forget the importance of looking at what's going on inside their body. So when we do screening lab work yearly or biannually, we can see what a horse's normals are. So if they do get sick down the road, we can look back at what their normals were for their individual patient. Additionally, we're able to catch diseases kind of before they're clinical, before the horse says, hey, hello, I'm sick, because we all know they can't talk and we all wish they could. So listed here are some of the tests that I like to do with my clients. A complete blood count will look for anemia or infection. A blood chemistry gives us insight into organ function and electrolyte disturbances. The fibrinogen will tell us if they're dealing with chronic inflammation, and it's kind of a flag to say, hey, look somewhere else, something's been going on. If we suspect Cushing's, we can run an ACTH. Dr. Pfeifer will dive into that a little bit deeper further in this talk, as well as a metabolic panel, including insulin and thyroid testing. And we already discussed the fecal egg count. You might talk to your veterinarian and see if they offer spring or fall packages. Sometimes veterinary clinics offer a discounted package where you can run a bunch of these tests all at once for just less than kind of an a la carte. Next, please. One of the questions that I get a lot from clients is, should my horse continue to work? My horse is 33 years old. Should I still be riding it? Or my horse has dropped suspensory. Should he still be moving? Bear with me here. This slide is a little bit nerdy, and I hope I have a few nerds in the field or listening to this as well. I'm going to refer to Newton's first law of motion, which in its very simplest form says an object at rest will stay at rest and an object in motion will stay in motion. Newton also describes inertia as an object's tendency to resist change in state of motion. Okay, so how this applies back to our equine patients, I'm getting a lot of hearts there, so it looks like there's some nerds out there. Thank you, guys. How this relates back to our equine patients. If we have a show horse that's used to showing and being on the circuit, being ridden 6 days a week, and on the 7th day is on an equicizer, and we decide to retire them, we just throw them in a small paddock and say, oh, you're retired, here's hay, you're probably happy, you're a horse. Their body is used to working. Their brain is used to working. And they really need to continue to move in order to stay happy in body and in mind. Likewise, jumping down to that little inertia word, if we take, if you go home, you listen to this webinar, you go home and you say, well, Dr. Catalino said my old horse needs to move. All right, now if you've got a pasture puff that's been a pasture puff for many years, don't go home and throw them on a lunge line and work them for 30 minutes because you're going to end up calling your veterinarian wondering why they're so sore. So small changes initially, but do keep them moving because it's great for their body. Next slide, please. I'm going to go through some of my favorite patients here that demonstrate different levels of stepping down but continuing to move as they get older. This first one here is Willie. Willie's a 22-year-old warm blood gelding. His highest level in the dressage world was Grand Prix dressage, but recently stepped down to a lesser position doing Prix St. George with my current client. He is happy working. He has lots of buttons, having done Grand Prix dressage. He gets joint support and is also treated for Cushing's, but that's him those are actually both him actively right now as a 22-year-old, and he's having a great time. There will be a time when he has to step down even further, but right now as a 22-year-old, he's doing great in this role. Next slide, please. This is Valonia. She's a 20-year-old gigantic warm blood mare. This picture does not do her justice. You don't really know how large this mare is until you're standing right next to her. She's one of my favorites as well. I'm going to keep saying that because I just love all of these horses. She was in her young years an upper level eventing horse. She transitioned over to dressage before she was 10 years old. Did dressage with her current owner up to 3rd level. Her owner and I decided in the last year that it was time for her to step down to a more or less retirement position because she is so large and it was becoming hard to manage her musculoskeletal disorders. Now her life looks like daily turnout with twice weekly, weather permitting, walk trot rides. The owner reports that she asks for the canter, and if Valonia offers it, they do it. And if Valonia says no that day, they don't. So she is still in motion because her body is large. And I think if we stopped moving it altogether, she would seize right up. So she's enjoying her half retirement. Next slide, please. This is Miss Mabel. She's approximately 75,000 years old. We don't actually know how old she is, but she is a perfect little potato. She looks like one, she's shaped like one, she kind of acts like one too. She is creaky. You can hear her walk down the aisle. Her joints all pop and crackle, but she's a happy girl. She maintains her weight well, and the way we keep her happy is a very light lesson program where she basically walk, and I hesitate to say jog, she walk and brambles around the arena, and it keeps her body happy, and she has a wonderful position in this lesson program where she's able to teach so many students. Next slide. My last example is Comet here, who is also approximately 75,000 years old in this picture. Similar age bracket to Mabel, but very different set of problems. You can see his coat is beautiful. He's got dapples, he's super shiny. Since this picture was taken, we've actually lost him this year, but you can see that he's a happy dude and his hind end is failing him. His legs were straight up and down, his fetlocks were dropped. So his retirement plan was eat what you want to eat because you're a happy old man, and live in turnout so that when you feel like you need to move around because your hind end is starting to seize up, you can. He had lots of room to lay down outside, so he never felt like he was stuck in a stall, couldn't lay down and couldn't get up. So this guy was in full 100% retirement and living his best life. Next slide, please. That brings me to the next topic, a stall and turnout situation for these guys. Going into the winter, we need to be especially concerned about the availability of fresh water. If you have automatic waterers, you got to make sure that they're freeze proof or check them multiple times a day if you're in an area like I am where the temperature is below freezing for weeks at a time sometimes, and monitor their function. Buckets. Interestingly, there was a study done in Australia. It was a very small sample size of 5 or 6 horses, but it was about color preference, and they found that horses actually had a color preference for their water buckets. So the top right bucket there is a turquoise bucket, and that's the one they found to be the most liked among horses. And now that I'm saying this, I don't have turquoise buckets at home. I have black and green, so I suppose I should get some. But if you have different colors of buckets in your barn, cycle them through and see if your horses prefer one color over another, one position of the bucket in the stall over another. There's also different shapes to buckets. So it's shown that those square buckets actually encourage more drinking than the round buckets. Talking to Bologna's owner earlier this week, we were hypothesizing that it's because their jaw does not hit when they get down to the bottom level of water. And so they actually drink a lot more water. Some horses are really picky about their water temperature preference. And you'd be surprised too. Some of them actually prefer cold water in the winter. If you put 2 buckets in their stall, one warm and one cold, they'll drink down the cold. Others are princesses and they certainly love the warm water. That's how I would be if I was a horse. Footing and bedding is especially important for our old horses as they start to have ambulation issues. Please make sure that your old horses have a clean, dry area to rest. If they're arthritic and they want to lay down, they need to be bedded deeply. Safe footing for easy movement means something different for each and every season. Mud, ice, snow, make sure that the ice is broken up for them. You can throw down some sand. Snow is removed so that they can move around well. Mud, if you have a good option for mud removal, let me know. I haven't figured it out yet. Other than making sure that you pick up manure and excess hay. Make sure that there's no obstacles or steep grades in their paddocks so that they can ambulate well. And it's important to remember high visibility fencing. If you do turn your old horse out in a new pasture, do so at the beginning of the day so they can figure out where the fence line is rather than at nighttime when they're kind of fighting for their lives and trying to figure out where the edge of the world is without going through the fence. Next slide, please. This slide might cause a lot of controversy. I see on our local horse owner pages, people asking if they should blanket or not to blanket every year. And there's really no good answer. There's a lot of variables that go into this, such as what the horse's environment is, what your weather is the horse body clipped or not? Are you personally cold or not? If I'm cold, I'm more likely to go out and blanket my horse a little bit heavier. but I always make sure that they're either not shivering or not sweating under their blankets. Again, if they're body clipped, you're going to want to blanket them potentially a lot heavier than you would if they were not body clipped. A time where you might want to blanket versus not would be if you are like me and you turn your horse out for the day, they do not have a run-in shed, and you go to work for 10 hours. The weather might change, so I tend to make sure they at least have a waterproof layer on top and they're nice and warm. Does the horse themselves run hot or cold? Please make sure that your blanket fits appropriately. There should be well-fitted chest, belly, and leg straps, especially for turnout. The blanket quality should be assessed regularly as well. Make sure that it is in fact waterproof, and there are no rips and tears. Once they rip a blanket, they're more likely to get caught on things, and that'll just lead to another veterinary bill, which we don't want. Pictured here is my little guy, Smokey, and he is demonstrating a poor attitude and a poorly fitted blanket. This blanket, his booty's hanging out, his belly's hanging out, his shoulders are hanging out. He's not happy about it. It is not waterproof, so if it rains, he's going to be even more mad. There are lacking belly straps and leg straps, so he could get hung up on that fence pretty easily. And let me tell you, he probably will, because he is a spiteful little dude. Next slide, please. This is my same little man. His ears are forward because he's now got a well-fitted blanket on. This blanket fits him perfectly. No body parts are hanging out that shouldn't be hanging out anymore. It is waterproof and has adequate straps for when he kicks up his heels and does the zoomies around the paddock. I have no question that this blanket's going to stay in place. Next slide, please. Hoof care is super important in our old guys when they start dealing with foot pain for any reason and offloading their feet. It immediately ricochets up their body and causes a bunch of other problems. So please make sure you're working with a farrier to make sure that your horse's feet are managed appropriately. Some common ongoing conditions that affect all horses, but especially our old ones, would be thin soles, laminitis, arthritis in their lower joints, navicular disease, and tendon injury. To note, going into winter, if they do wear shoes to manage any of these conditions, make sure that your farrier, I'm sure they are, but chat with your farrier about what snow package they're applying so that they don't end up walking on ice balls and sliding around like Bambi on ice. This might come in as snow popper pads or rim pads, but they should also have studs, small studs, so that they can grab and have traction when the ground freezes. Barefoot horses actually naturally shed ice balls. The bottom of their feet heats up, the first layer of the snow, and the ice balls shed. That's not to say that you don't ever need to pick your horse's feet out in the winter, whether they are shod or not. You should still be picking them out once a day. And if you're in an area where winter looks like mud instead of snow, make sure that you're monitoring and treating for thrush as well. Next slide, please. Here's a couple pictures of those snow packages. On the left is an anti-ice ball snow rim pad. I actually don't know the real name for those, but that's going to help maintain no ice in their foot. But again, pick their foot out regularly. I prefer the popper pads, which are on the right, if your horse can handle it. Not all horses can handle something covering their whole foot, but those popper pads really don't allow ice to build up. I really like them. Next slide, please. Body condition scoring is something that any horse owner should familiarize themselves with. I don't think that you should obsess over it because you see your horse every single day. But I do think that every month or two, you should have a look at a body condition score chart and a look at each of your horses. In the winter, make sure you're pulling blankets off regularly so that you know what your horse is looking like under there, if they're gaining or losing weight, or if they have any sores. The body condition scoring chart that I'm going to go through here is the Heineke body condition score chart. You can find it online. It goes through a score of 1 to 9, 1 being super thin and 9 being morbidly obese. If you look at the top right diagram here, the areas to note in this body condition score chart would be the crest of the neck, the withers, the tail head, the rib coverage, and behind the shoulder. And I'll spare you from going through every single part of this chart, but a body condition score of 1 out of 9 is basically as thin of a horse as you can imagine. You can see all of their neck bones, you can see all of their rib bones, their top line is really bony. They don't have any fill between their transverse processes and their dorsal processes, dorsal spinous processes of their spine, and their tail head has no fat. Go ahead and advance to the next slide, please. The ideal body condition score for a horse is going to fall somewhere between a 4 out of 9 and a 6 out of 9, depending on the breed. A good example of a horse that we want to be at 4 out of 9 would probably be a thoroughbred. 5 out of 9 is more of a typical quarter horse type horse, or potentially a thinner warm blood. A 6 out of 9 would be a heavier, draftier warm blood, or your draft breeds. And when you guys look up this chart and do it on your own horse, you can kind of figure out where your horse lands, but somewhere between a 4 and a 6, kind of moderately fleshy, but not morbidly obese is where we want them to land. Going into the winter, it's nice to have our older horses at 5 to 6, but remember when you start feeding them hay when it's cold, extra hay or whatever you feed them. I'm not gonna spoil what we feed these horses because we're gonna go into a little bit more nutrition later in the talk, but when we increase their calories when it's cold, you just want to make sure you're also not increasing their condition. Next slide, please. I just wanted to point out that an extremely fat horse, or a horse of a body condition score of 9 out of 9, is in just as much danger as a horse at a body condition score of 1 out of 9. They're going to have different ailments, of course, if they're morbidly obese, but if you see a horse that looks like the Michelin Man, you should probably call your vet and see what you can do to help them lose weight and see if they have any metabolic disturbances. Those horses are at risk of foundering. Next slide, please. So transitioning right into nutritional requirements, horses prefer to spend at least 60% of their time grazing, if not more. Aside from the nutritional requirement of it, it keeps them busy. Limited eating time leads to behavioral issues, horses running through fence, asking for feed because they think they deserve more, as well as digestive problems. If they don't have forage in their gut, they are predisposed to getting gastric ulcers and such. Forage should be at least 60% of their diet, but up to 100%, and it should be fed at a rate of 1.5 to 2% of their body weight per day. So for example, a 1,000-pound horse, an average horse, should be getting 15 to 20 pounds of food in total over the course of 24 hours, with 12 to 20 pounds of this being forage. When horses are eating their long stem forage, they chew down to 1/4 inch pieces of hay before they swallow it. So these old guys, when their teeth start to fail them, we need to help them, kind of achieve that goal before they swallow whatever they're eating. This basically just means that functional teeth are required for proper mastication of long stem forage. And if they can't do that, then we need to support them. Next slide, and I'll hand this over to Dr. Pfeifer.
All right. Hi, everyone. So we're going to move into the common diseases of our elderly friends here. As Dr. Catalino has kind of touched on a few of these topics here, we're going to go into kind of 3 of the main ones, and then some secondary issues that arise from these primary issues that we see in a lot of our older guys. So going off of the nutrition slide that Dr. Catalino just mentioned, we do see a loss of dentition, other dental issues that affect how we manage these horses and their quality of life, and their weight management and everything. We'll go into that at the end of this section here, as it's a little bit longer than some of the other portions. Then we will also discuss a common disease called Cushing's disease, which is more commonly known as, with the scientific name or proper term being pars pituitary intermedia dysfunction, or PPID. We'll also go over some osteoarthritis or, just arthritis of joints in these elderly guys as they get older. We see that more and more throughout their bodies. And then again, we see a lot of secondary issues from some of these common things, such as choke, colic, decreased immune function, muscle atrophy, and more. Next slide, please. So starting with Cushing's or PPID, this is an endocrine disease. It's caused by malfunction of a portion of the pituitary gland in the brain. And essentially there's a hormone cascade that is affected, and it causes an overproduction of adrenocorticotropic hormone, ACTH. There's a reason we abbreviate a lot of the words that we say. But yeah, so it's basically causing a overproduction of that hormone in the body, which affects a lot of different body systems in the horse. There is a research conglomerate called the Equine Endocrinology Group. They have an excellent overview of the disease. They're primarily targeted towards veterinarians and management of their patients, but they do provide a lot of great information on the testing results and interpretation of those and treatment options for the horse, going forward. And then as far as the population of horses that we're seeing this in, they're typically older than 12 years old. And again, this is mostly a disease of older horses. So we're typically seeing this in the later teens, early 20s and beyond, but it is, not unheard of to have it in some of those, mid-teens horses. It's just more commonly seen in the older guys. And then, like I said, it can affect many body systems and greatly impact a horse's quality of life, especially if they do not have a good response to treatment or it's not being managed properly. Next slide, please. So the AAEP actually did a little Facebook post, a social media graphic here not too long ago, a week or two ago. So I did throw that in here just as a little refresher. And for those of you who are better visual learners than all the words I've got thrown on this slide here, we've got a nice vision of those clinical signs and things that can affect a horse with PPID. So a lot of the clinical signs that we think of with Cushing's or PPID is everyone says, my horse is shedding out fine. There's no way they have PPID. There's no way they have Cushing's, but it's definitely more than a long hair coat. So one of the most common things that I see in my patient population is a sudden weight loss or weight loss despite having adequate food available and adequate food intake, ruling out other issues such as dental things and management concerns there as well. And so that is a big part of this disease is that weight loss, that muscle atrophy. Some other things that we'll see is abnormal sweating patterns. As Dr. Catalino mentioned, not only when they're getting older is their immune system kind of decreasing, but it really does kind of tank when they have PPID or Cushing's. So we'll see things like recurrent foot abscesses or corneal ulcers or scratches, skin lesions, skin infections. We'll also potentially see more laminitis in this population of horses. They may have some abnormal fat storage or pocketing. And a lot of times you may be seeing more urine spots in their stall, and their buckets may be, empty when they used to be, a quarter full in the morning when you go check on them. So they're having an increased urination and water intake. And again, the classic, and we'll see a picture here in a couple slides, but the classic thing that everybody thinks about is the long hair or the patchy hair, but it is possible to have Cushing's and not have that classic hair coat. Next slide, please. So here we go into some of the testing and the treatment options and considerations. Again, for your specific horse and your specific cases, as always, consult with your veterinarian as we go into these treatment options. But for testing, there are basically two tests that we can utilize for PPID. And one is a baseline. It's more of a screening test. This is a simple blood draw that your veterinarian can do and send that to the lab of their choice. Or run that in-house. It may not catch all positive cases because, again, this is a screening tool. There is a more definitive test called a TRH stimulation test. So this requires an IV injection of a hormone in that cascade that leads to the overproduction of ACTH. And this requires a blood sample at the beginning of that testing period. We give the injection, wait 10 minutes, and then we draw a secondary blood sample and check those through the lab as well. Again, that one's more definitive. And I know we're always looking into our, our wallets and our bank accounts when it comes to these guys, especially as they get older and we have more medications and treatments that we need to do for them. But again, that TRH one, it helps you not worry as much, being a more definitive test, if you're talking with your vet about that. So, all right, we've decided, yes, they have Cushing's. We've done our testing. We've seen our clinical signs. We've put the whole picture together. The gold standard FDA approved treatment at this time, which unfortunately does not have a generic, is Presend. So, the medication is called Pergolide, but Presend is the go-to for this disease at this time. Some horses do not tolerate it well. I would say the majority do, at least in my client population, or patient population. But there are some adjunctive or alternative therapies. Say we've maxed out on Presend and we need to consider another supportive medication or supplement. Your veterinarian may discuss that with you on a case-by-case basis. Some of those medications, just so you're familiar with them, might be cyproheptadine, might be cabergoline, and then SmartPak does make a smart pituitary senior pellet supplementation that I do. Some of my clients have their horses on, and they report that they like that supplement for their cushingoid horses. Again, you want to make sure you have an appropriate diet to maintain adequate weight and muscling. Not only isn't that important with this, but all the time in our senior guys, but you may need to work with your veterinarian on putting weight back on these guys, especially when they're getting initially diagnosed, and to ensure they have a proper diet. A lot of people wonder, can I feed a cushingoid horse alfalfa? Can I feed them grass? Those might be okay. Again, it depends on a case-by-case basis with the horse. There is no general rule that says you cannot feed cushingoid horses alfalfa or grass. And we will touch a little bit more on nutrition on a separate slide here in the future of this presentation, but I did just want to point that out. All right, next slide, please. So again, this is just a reference picture of a very cushingoid little pony here. This is Marley. Marley is about that 75,000 range and age. And so Marley had a pretty gnarly hair coat, and was fairly thin. Started getting Marley on proper diet and started her on Presend. And I think this was about a 6-month time difference, 6 to 9 months. But it's amazing, what proper nutrition, proper medical management and things can do to get these eyes under control. So regular check-ins with your veterinarian, coming up with a plan for them, and basing it on the individual horse is super important. Next slide, please. All righty. So I know there are a ton of questions about arthritis, at least in the registration questions, and looks like coming through the Q&A. So hopefully we can get some of these addressed here. So I'll start out with the pictures on the right of this slide. They are from a 20-plus-year-old paint mare. And she's actually a pretty stoic gal. She didn't really have too much lameness in her initial evaluation. When I did her flexion tests, though, she did kind of test positive to those. And in her radiographs, we found that she had some carpal arthritis. So you can kind of see there's a little friend. Yes, thank you, Karen. A little friend there on that lower left side of the carpus. And that is a bony change, and you can kind of see some narrowing of the joint spaces there within the carpus. And then the lower picture is of her back hock, and we have almost, some complete fusion of the joints within the hock there, as well as narrowing of the other ones and some bony remodeling at the edges of those bones there as well. So again, individual horse basis. She is currently controlled with daily Equiox and which is a NSAID, an anti-inflammatory pain medication. And she does get light, regular exercise at this time, mostly walking with a little bit of trotting in there throughout the week. So clinical signs we'll see with these guys, stiffness, difficulty getting up, and sometimes they often won't lay down as much too because they know it'll hurt when they try to get up, or it may hurt for them to get into position to lay down as well. They'll have lameness or limping, and they will have some muscle atrophy potentially because they're not using those limbs because it hurts. They might have some pain on palpation of the affected joints, and they might have swollen or enlarged joints of the ones that are affected. And I did want to just emphasize that lameness, limping, stiffness, changes in gait are an indication of pain. As they get older, yes, they may develop arthritis. They may develop it in multiple joints, but just because they're old doesn't mean they should be limping or it's okay for them to be limping. We want to make sure that we're taking care of them from a pain standpoint so that they can have, a good quality of life for however much time they have left. Next slide, please. All right, so this one is a doozy. Sorry for all the words. But we've got some of our potential treatment options. So when I start discussing arthritis treatment options, especially with an owner who's an open slate, hasn't had to deal with, a horse that has arthritis yet, you can go down quite a rabbit hole of treatment options. So again, it's really important to work with your veterinarian, discuss your goals for your horse, what you're financially able to do, what you are time wise able to do, because some of these require a special schedule and for them to be as effective as they can be. So again, we want to take into consideration both the client's ability and the patient's ability and conditions to be able to figure out the best plan possible and give that horse and that owner the best quality of life and the best relationship possible. So in looking at some of these treatment options, we've got joint injections, which are classic, steroids, hyaluronic acid, that kind of thing. As time goes on, we've gotten in the last few years quite a few different options as well. So we've got biologic options, which basically, we can take a sterile blood sample from your horses, spin it down. Different companies have different types of products, but things like ProStride or IRAP or PRP, that kind of thing. A2M, all of those are, different biologic options. And then we move into some of our other medications that are typically oral medications. So Bute, comes in the powder, the paste. There is an injectable that your veterinarian might have, but typically we send home those powders or pastes. We also have Banamine, and I've got the Banamine is a trade name. So the actual drug name there is flunixin meglumine. Again, Equiox is also a trade name, and that drug is for coxib. So those are all of the oral NSAIDs that we use. There also is a option for a topical, which is Surpass ointment. And all of those are within the same drug family. Some systemic injectable joint supports that are out there right now and have FDA approval for use in arthritic horses are Zycosan, Legend, and Adequan. Again, all the trade names, but I do have the actual drug names listed there. So we've got Pentosan, hyaluronate sodium, and then polysulfated glycosaminoglycan. And again, those have different dosing schedules, and the Zycosan and the Adequan are both intramuscular. So a lot of times owners are more comfortable giving those at home, whereas the Legend is typically given IV. You can give that in certain cases IA, so interarticularly into the joint. But owners obviously are not typically as comfortable doing that as they are an intramuscular injection at home. And then, as Dr. Catalino mentioned with some of her patients earlier, there are some really great complementary therapies that we can do for these horses. Those include, again, but are not limited to acupuncture. I see some hearts there. I love it. But acupuncture, chiropractic work, physical therapy exercises, shockwave treatments, laser therapy, herbal supplements, things like that. So there are a lot of, Eastern and Western medicine that we can kind of mix together to find the best cocktail for your horse and your situation there. And I do, want to emphasize there is no one size fits all scenario. We need to have plans adjusted for the individual horse and the goals of the owner. And there was a question that did come through in the registration about, well, what do we do for pain management for horses with kidney issues or liver issues that Dr. Catalino had mentioned? We like to screen for those things with wellness testing, wellness blood work as these guys get older to see what they're doing internally. There are definitely still pain management options for those horses that have organ issues. And again, specifically, you'll want to chat with your veterinarian about, depending on the organ issues, commonly, kidney and liver things. But there are additional medications that have some newer research too, including acetaminophen or Tylenol, gabapentin, amantadine, some opioids, local nerve blocks, joint support options like the Adequan and Legend and Zycosan are all other options as well. Typically in horses with kidney issues, we like to try to avoid steroids or the NSAID family, and medication that we commonly use for navicular changes is Osphos, which can be difficult on which is a bisphosphonate drug, but that can be really hard on the kidneys as well. So again, individual plans for individual horses, and chat with your veterinarian about what would be best for you guys there. All right, next slide, please. So joint supplements are always a interesting topic. Nobody wants to waste any money and everybody wants to do the best for their horse. And so I'm just going to, flat out say there aren't a lot of peer-reviewed research articles about joint supplementation, oral joint supplementation in horses. We did have a couple articles here that we wanted to provide for you guys to kind of allow you to figure out, okay, this is how to choose a proper joint supplement. This is the ingredients that I should be looking for, and this is the amount in those joint supplements to be finding, because there are so many out there. And again, it's great to have a discussion with your veterinarian about specific ones you're thinking about using, because they can look into those for you, see if they're good for your situation. But also, we want to empower you guys to be able to kind of look into those things for your horses as well. So I don't know, I think Karen might be able to throw this in the chat, those links there, so you guys can access them. But I did want to point out that oral joint supplements are not regulated by the FDA. So again, we want to be careful, do our research before we start feeding, just anything to our horses there, and do your research on the companies that are making them. Look for research-backed products if you choose to use them. And the second one, the second link that I have listed there with the acclaim method is really neat, because it talks about what to look for when you're researching. You can just type into Google AI or ChatGPT or whatever, but these are the things that you're looking for with those supplements. So is it a recognized name? Is there clinical experience with this supplement recorded? Does it list the contents of the product? Are there label claims? What are they? What should you be expecting with this supplement? Does it have administration recommendations? Does it have dosage recommendations? Does it have a identification number? So if something goes wrong with the supplement, or you have questions about it, you can reference that specific batch, or you can reference that product tracking number or lot number with the company. And that goes right into, does it have manufacturer support and information for customer support for you and your horse? Most really good supplement companies that do have all of those things, they are more than willing to stand 110% behind their products and will help you out. All righty. Next slide, please. So again, those are some of the main ones, and we'll get into teeth here soon. I know that we've kind of been dancing around it here and not really getting into it, but we'll get there soon, I promise. So these are just, a little quick snippet of some secondary issues that we will commonly see with these primary, causes. So with the osteoarthritis, again, we can see some of that weight loss. We can see muscle atrophy. They're not moving around because if they're not managed properly, because they're painful. If we're not moving around, we're not getting to our water for adequate water intake, those kind of things. We might experience some colic. Or as Dr. Catalino mentioned, we might also be seeing, some gastric ulcers because they're stressed about their pain, or, they're not readily accessing their food because it hurts to get over to it. And we may also be seeing some behavioral changes because I know if I'm hurting, I'm a little grumpier than I might normally be on a good day. And for the PPID and the Cushing's, again, we see some of that weight loss, some muscle atrophy as a result of that endocrine disease. We see a lot of the decreased immune system and delayed healing for those wounds that do occur. And they are more prone to laminitis in uncontrolled Cushing's as well. And then as far as the teeth and the dentition, you can see a common theme here. Weight loss and muscle atrophy they're big parts of this in our old guys. And as well as choke risks, if they aren't able to masticate or chew properly because of their dentition or because of dental issues, that becomes a big concern, as well as colic. If they, again, are not eating the proper diet, then we could be running into some issues there. Alrighty, next slide, please. We've made it. We finally made it to the dental slides. So I'm going to chat a little bit about, some general dentistry topics here, and then I'll hand it back over to Dr. Catalino to go over some EOTRH questions and discussion as well. And I know there were a lot of pre-registration questions regarding these as well. So hopefully we hit on some of those points. So as far as aged horses and keeping their mouths healthy, we're looking into going from potentially annual exams to biannual exams, again, dependent on your individual horse and their individual cases. Sedated oral exams by your veterinarian are key. This will help you determine the diet that you need to feed, what we need to be considering going forward with management of your horse. So oral examination allows us to look at each tooth individually. We can, by using sedation, we can put a speculum on. We use a light source and a mirror, and we can utilize a headstand or a dental halter to take a look inside the horse's mouth. I always tell my clients I need all of those tools to do the best job that I can. I don't like wasting people's money or time. And so by sedating your horse, by placing a speculum, by keeping them happy, comfortable, and in a controlled scenario, we're able to see every single tooth in their mouth and do a full assessment to give you guys the best plan going forward. So some things that we can look at when we're doing that dental exam include potential tooth decay or cavities, periodontal disease. So when we see basically diastemas, some gingivitis, food packing between the teeth. We can also find fractured or broken teeth, which a lot of times, can cause behavioral issues or pain or changes in eating for horses. We might find injuries to the cheeks, tongue, gums, whether that's sticks being stuck in the roof of the mouth, things like that. And we can also find any other abnormalities. So if, your horse has malocclusions, such as ones that create, hooks or ramps or things that may need to be taken down more often than an annual float. We're able to identify that and proceed accordingly. Next slide, please. So another big fancy word we will learn tonight is that horses are hypsodonts. So hypsodonts mean that their teeth are constantly erupting, but they are not constantly growing. They do have a finite amount of tooth once they have their adult teeth in. Within their first 5 years of life, a horse erupts up to 68 teeth and loses 24 baby teeth. So that eruption and wear per year is about 2 to 3 millimeters. And as forage is ground down, so is the tooth. They've evolved to have reserve crown to replace the clinical crown. So that reserve crown is what is underneath the gum, and the clinical crown is what is showing above the gum. The way that horses have their heads shaped as well, their upper jaw is wider than their lower jaw, is the way that some of those sharp points and sharp enamel points can form on the outside of the upper cheeks and the inside of the lower jaw against the tongue there. So unfortunately, they will run out of tooth eventually. And if they live long enough, they will run out of chewing surface going forward there. Next slide, please. So this is just a nice visual representation. We've got a little coin there for size reference. But we've got the tooth of a 7-year-old going all the way to the tooth of a 30-year-old. And as you can see, we do have that finite amount of tooth that is decreasing over time. That tooth is erupting through the gum to replace the clinical crown or the exposed portion of the tooth in the mouth. But unfortunately, these guys do run out of teeth if they live long enough. So we are lucky to have that little nub in there if we can get them there. Next slide, please. All righty. So these are showing the occlusal surface or the chewing surface of the tooth. And as you can see, there are different colors there. There's ridges, there's bumps. It's not a smooth surface, and that's by no means what we want to see. We want this rigid, this surface with ridges and bumps. We do not want an ice skating rink for these guys to be able to masticate properly. So like we talked about, they're self-sharpening due to the way that they chew, their jaw structure, and the different materials with varying levels of hardness in their mouths. They have hard, brittle enamel sandwiched between softer dentin and cementum. And so they will get different wear on the surface of their chewing surface. And that allows them to chew properly. And just to kind of jump into, some of those different materials within the tooth, we've got, like I said, the cementum, the dentin, and the enamel. The enamel specifically is the hardest material in the body. And this one is white because it doesn't stain as much as the cementum and the dentin. But it is worn away the slowest because it is the hardest material there. And it's responsible for grinding the forage down to that 1/4 inch that's necessary for them to utilize in their digestive system. And this is where our sharp enamel points are developing continuously that we talked about, the outside of the uppers and the inside of the lowers. All righty. We can go on to the next slide there. So what are we doing with these old guys who are losing a lot of their teeth or losing that occlusal surface or chewing surface for these guys? Obviously, we talked about they do need proper mastication and they do need a proper occlusal surface to be able to chew those long stem forages. And so some considerations that we need to take a look at are the type of feeds and feeding management. Are we feeding pasture, a high grain diet? The individual anatomy and conformation of the horse's mouth. Are there those malocclusions that are developing the hooks or the ramps? So, do they have a parrot mouth? Things like that that might create other issues. And, do they have gum disease? Do they have periodontal disease? Do they have diastemas with feed packing? And, do they have missing or fractured teeth? All of these things factor into what are we feeding, how are we feeding it, and how much are we feeding. So management of those individual problems can prolong the functional life of a tooth. And again, it's important to have a competent professional veterinarian take care of this dental care, because overly aggressive dental care is, essentially just as bad as improper dental care, because if you're grinding down that clinical crown, and especially that occlusal or chewing surface, and creating an ice rink for these horses to chew with, that's a big problem, and it can shave years of their chewing surface away and cause other issues as well. All right. You don't mind switching to the next slide. Thank you. So we've got expired teeth, we've got missing teeth, we've got cupped out teeth, teeth that are not functioning like they should be. We need to look into alternative forage sources for these guys because they are not able to masticate down to that 1/4 inch hay that is required for proper digestion. So we've got things like grass, chopped alfalfa, or chopped Timothy hay. We've got hay alfalfa or Timothy hay or alfalfa cubes. I want to kind of emphasize that those should be soaked to decrease the risk of choke because they are so dehydrated. If we're swallowing those or having the horses swallow those, there's a risk for them expanding with the moisture in their throats to cause choke. Mashes with beet pulp, rice bran, and again, those alfalfa hay pellets or cubes. We can also look at complete feeds, which are meant to provide all forage, vitamins, minerals, and any other nutrients such as proteins and fats that an equine requires every day. And then we also have our senior feeds, which typically fall under that complete feed category. But a lot of them do have, potentially some molasses or some extra fat in them to help older animals it be more palatable to those older animals and help them maintain weight. And I think one thing that all of us here want to emphasize is that an old horse does not mean a skinny horse. An old horse, as you could see with many of the images that Dr. Catalino shared at the beginning of this presentation, those horses they're beautiful. They have great weight management, great muscling, and are well cared for horses. And being old is no excuse for a horse to be skinny. I do want to discuss that a slow introduction to these alternative forage sources before they're required can ease the strain and stress of trying to get a skinny horse to eat something new because it can't chew its old food. So I definitely recommend trying to introduce mashes when horses are younger, just so, you don't have to feed them all the time, but just so that horses are, they don't go 25 years eating regular hay and then all of a sudden you pull that and give them multiple mashes a day and they're like, what the heck is going on here? I'm not eating this mush. And then you do have the horses that love it. I actually had a 34-year-old standardbred who had some horrible dental issues, and he when we took multiple of his teeth out, he already didn't have a great chewing surface or grinding surface on the remaining teeth. He didn't like his mashes. He liked soup. So he pretty much drank soup for the remainder of his life. And that's the way he liked to consume his food. So to each their own with these guys. And that's why we keep stating, they're individuals and you got to treat them as such. You do want to find a forage base that they will, obviously not require as much chewing. And many of our elderly guys do have other nutrition restrictions to take into consideration when we are choosing those forage replacements. So just a couple things to note, if we are looking at an insulin resistant horse or a horse with EMS or metabolic syndrome, the alfalfa and molasses-free beet pulp are lower in sugar than grass and hay. Our cushingoid horses, some of them, if they are receiving a high sugar diet, that can potentially be linked to promoting, additional dental issues that have in those horses that have compromised immune systems. If a horse has HYPP, we want to make sure we're limiting that alfalfa and potassium. Also, horses with kidney disease, we want to make sure we're limiting that alfalfa because it is so high in protein, which is difficult for those kidneys to process there. And then for those horses that have PSSM, we want to make sure we're limiting our starches. All righty. Next slide, please. And then I'll hand it back to Dr. Catalino.
All right. One of our themes of tonight, aside from old horses don't have to be skinny and old horses don't have to be in pain, is we're going to say words that are really hard to say. So equine odontoclastic tooth resorption and hypercementosis, and that's the last time I'm going to say that, is known as EOTRH. We're seeing this more commonly now. I think it's not more common, but we are screening for it a little bit earlier. It affects middle-aged to geriatric horses, and we're not really sure what causes it. But this disease is a disease process of both tooth resorption and abscessation, as well as hypercementosis, which means the addition of bone where it shouldn't be. And it causes kind of a bulbous root to the tooth. So you can see in these pictures here, I can't point because it's not my screen, but on the bottom right-hand corner, those teeth, yep, they're starting to show some calcification there along the gum line, and then the gums themselves are super bulbous. The top right, that horse is looking long in the tooth, as you might say. There's a lot of gum recession on, or gingival recession on those lower incisors. The top incisors are super bulbous. You see tooth material where there's not necessarily a tooth, a whole tooth associated with the calcification. So this is kind of classic presentation of an EOTRH horse. Those images of radiographs are kind of what is happening below the surface there. Nice healthy bone. It looks like that bottom left picture. If you look at the top of the teeth, that's kind of healthy bone where it's, sorry, Karen, if that's your cursor, the bottom picture, the top portion of the teeth is kind of healthy bone. And then as you get farther down into the bone, it turns into like this mottled appearance. It looks almost spongy, and it is kind of spongy. So that's where the teeth are abscessing and they become fractured pathologically or loose. This disease process is most commonly appreciated in incisors and canines. It can affect cheek teeth, but that is a lot less common. The resorption that we see with these teeth is what we kind of see in cats and humans as their teeth decay as well. So if you've had a cat with resorptive lesions, this is very similar. The main points to note for this disease process is that once it starts, it is progressive. It does not go backwards. We cannot slow it down or reverse the effects, and it is quite painful. It's very painful. And actually, this is one of the diseases where I think horses are very stoic. A lot of times horses can be weenies and, get gas caught up in a corner of their gut and throw themselves to the ground for 20 minutes and scare us all that they're dying. And then they get up and say, what? I'm fine. With EOTRH, however, they slowly increase their pain level over the course of years. And I think they are able to accommodate for this low throbbing pain for so long that they don't really show us any signs of it. So you really have to rely on that sedated oral exam to know what's going on and your veterinarian's recommendations. Next slide, please. The pain response associated with EOTRH can be varied depending on the horse. Some horses reduce the amount that they graze on grass in pasture. So you might see that weight loss again. So if you see weight loss in an old horse, it can be one of about 10 different things. They might start head shaking. If it's a horse that is still being ridden, sensitivity to the bit, especially if the bit hits them in the teeth before they open their mouth. You might see some hypersalivation or increased drooling, sensitivity to the periodontal probe when the equine dentist, veterinary dentist comes out. My most common symptom that is the first one that I notice or clients notice is when I'm out there for that sedated oral exam. I throw them on the speculum. The way you open their mouth with the speculum is by putting a plate on the inside of the top and bottom incisors and applying pressure to open their mouth. And that applies direct pressure to these teeth that hurt. So those horses that have, I've known their whole lives, they've been good their whole lives. And then one year we put them on the speculum and they throw their head up and they just absolutely resist. And they say that hurts. That's when it's time to start looking for some underlying EOTRH. Additionally, we start to see bone infection, but there's usually no eating issues. These horses typically aren't showing a lack of interest in their feed. So it's kind of hard to screen when there's no external signs until we see a pain response or the veterinarian notices minute changes. I just saw a horse yesterday, I think it was, for his routine oral exam. I see him every year. I open up his mouth twice a year. And in the spring, everything was hunky-dory. This exam, I opened up his mouth and one of his incisors was quite loose. And so we are screening him for EOTRH, and he's probably going to go for treatment here soon. Next slide, please. More clinical signs beyond the pain response. So that gingival recession that I mentioned, these pictures are quite drastic. All EOTRH horses do not have this wild of changes, but this is what you can see if they go untreated. Gingival fistulas with discharge or pus draining from a tooth root type abscess, swelling under the gums. You can appreciate that on both of the pictures on the right to different extents. Inflammation or just reddening of the gums is sometimes one of the first things you see, just red gums and no overt swelling. Tooth discoloration, that bottom left picture is a ton of discoloration and calculus. Feed accumulates between all of that calculus. You start to see missing teeth that they eject on their own accord between veterinary visits. Loose teeth and pathological fractures, like I mentioned, sometimes they get a foul odor to their mouth. And it is very important to know that this is not what old horse teeth look like if they are healthy. If your horse's teeth look like this, we need to do something about it. That's like walking up and saying, hey, my horse is skinny. It's skinny because it's old. Nope, that's not the answer. And your horse's teeth don't look like this just because they're old. They look like this because they have a disease process and it's quite painful, and there's something that we can do for it. Next slide, please. So true diagnosis is through radiographs. You can only see so much from the outside of the gums, but there are definitely clinical signs that lead us to a strong suspicion of this disease process. When we do radiographs, though, we can see the extent of the bony involvement. We can see quite easily the incisors and canines and which teeth need to come out. Treatment includes initial clinical exam and talking with you, the owner, to see how the horse is doing. Are they maintaining weight? Are they eating okay? That's going to help us assess their level of pain. Although I will say it's difficult sometimes to assess their pain level because, like I said, they've slowly ramped up. They've started with teeth that are normal. They start to deal with a little bit of dental pain. And then the next year they have a little bit more dental pain. Anybody listening that has chronic pain, you get used to a certain level of pain. And until it passes a threshold, we don't really see any changes in these animals. We assess their overall systemic health, screening them as well for Cushing's again. And then once the disease is progressed to the point where we think the horse is being affected in one way or another, the main treatment course is removing all of the incisors on block. It's a little bit scary to owners because we go in and we remove all of the top incisors and typically all of the bottom incisors in one go. But I assure you that it is very common procedure, and the horses usually come out of it feeling like $1 million because they've been in pain for so long. Next slide, please. Some post-extraction feedback is that they have improved attitude and body condition. These horses are able to work, eat normally, and graze. They have a hard time grasping at short grass because they no longer have their incisors. You see this guy on the right can't hold his tongue in his mouth anymore. That's pretty common, and they do just fine. Their tongue is able to go back in and get wetted and come back out. But if you can imagine, they don't have any teeth holding their tongue in, and it's got to be exhausting holding that thing in all the time, so they just let it hang out. These are some actual client quotes down here that he seems so much happier. He feels like a young horse again. Again, those ridden horses become more forward. Maybe you don't need to ride them with spurs anymore. And almost always I hear this one, I should have done this years ago. So it's a really scary procedure to talk about with your veterinarian. You're removing a whole bunch of teeth. It seems like a really big surgical procedure. If your horse is a good candidate, they can stay standing for the procedure. If they're very painful, they do it under general anesthesia. So talk to your veterinarian about that. But please do let us coach you through it because these horses do a lot better once they are managed with extraction. Next slide, please. And pass it back to the very last leg of this to Dr. Pfeifer.
Thank you, Dr. Catalino. So moving into a topic, again, this isn't a super fun topic. It's not one that we really want to, have a great big to do about, but it is something that's important to note, and it's one to have, a plan for. And so you're not calling your vet in the middle of the night with a down horse and you haven't thought about this at all. Again, it's not fun, but it's something that we need to consider for our horses and ourselves. So A question that we get a lot is, how do you know it's time? You know your horse best. You know their favorite things. You know their behaviors. When they're showing signs of pain. And so it's really important to pay attention to those things, and consider those for your individual horses. Have those discussions with your veterinarian. Have a plan in place, when it is time to say goodbye, when it is time to let them go. Are you going to have them cremated? Are you going to bury them on your property, depending on where you live, and that kind of thing. How is your veterinarian going to do this? Learn the situation before it's an emergency or it's a panic situation. In order to kind of differentiate, some of those good days versus bad days, I have a lot of clients, keep a journal or a calendar. It's as simple as getting, a calendar from Walmart or whatever, and putting a check mark on it if it's a good day, or an X on it if it was a bad day. And that way you can kind of look back over the last few weeks and be like, hey, we only had 2 good days this month. Because we like to hold on to those good memories and we like to hold on to the good days. But if the bad days are happening more often than not, for your horse, then that's definitely time to start considering quality of life, and euthanasia, humane euthanasia at that point. So some things to think about: is your horse able to move around? Can they get up and down easily and comfortably? Again, we talked about different scenarios earlier with arthritis. If they can't move around, they're at the end of the day, they're prey animals, and that's terrifying to them. And not only is it terrifying, but it's painful. And so we need to think about their mobility. We also need to think about, are they able to hold weight well? Are they getting, they're getting an appropriate diet? Can they still maintain with that diet? When clients are, wondering, am I doing this too early? It's often easy to think about it as, it's better a day too early than a day too late. Again, it's really hard to make decisions, and when you're in a super emotional state with an emergency, a down horse, a colicking horse, arthritic horse, that kind of thing, than it is to have a plan worked out with your veterinarian ahead of time. Obviously, we can't avoid all emergencies and whatnot, but you want to try to get there before it becomes an emergency. Those planned euthanasias are often kinder than waiting till they're too thin or too weak or too sick, to be able to care for themselves. And at that point, it becomes an immediate decision. You're looking, at least personally, I tell all of my clients, I am a quality over quantity veterinarian every day of the week. I want my horses, I want my patients to be comfortable. I want them to have a good quality of life. And I'm here to advocate for that horse and work with the owner to make them, have the most positive experience they can with their horse, and to take care of them the best they can. And that looks different at every home. But again, we've gone through a lot of the management, and treatment options here, but we want to make sure that these horses are having a good quality of life at the end of the day. Next slide, please. So to get a little scientific about it, there is Dr. Carolyn Stoll at UC Davis. She does some research in this area, and has written a couple articles about it and whatnot. But she references the MED-W criteria. So this stands for movement, eating, drinking, and weight. So again, can your horse move well? Can it get up and down well? Can your horse consume feed well? Is their diet conducive to maintaining that appropriate body function and weight? Can they get to their water sources? Are they consuming enough water? If we're not getting enough water, if we're not able to get there, that's definitely a problem. And then, so we're feeding them, they're drinking, they're moving, but are they maintaining that weight? Are they within that adequate body condition score range of the 4 to 6 out of 9 that Dr. Catalino talked about earlier? If not, they're not able to support their normal body function, and we really need to consider quality of life at that point as well. All right, next slide, please. And then just to reference the AAP's euthanasia guidelines, these were last published in 2021, but it's a good, kind of black and white reminder almost to see, if I were looking at this from a black and white standpoint, which this is never, a black and white situation, these are the things that we need to look at. So is there a continuous or unmanageable pain from a condition that is chronic and incurable? Is there a medical condition or surgical procedure that has a poor prognosis for a good quality of life? Is continuous analgesic medication and or box stall confinement for the relief of pain for the rest of its life, is that a scenario that's going on? Or is there an unmanageable medical or behavioral condition that renders the horse a hazard to itself or its handlers? So these are all things to, kind of objectively take into consideration when you're making a very subjective decision there with your personal horse. All righty, and I think that leads us to our last question slide here. And we've managed, I believe, to touch on the majority of the registration questions, but I think Dr. Catalino is keeping track here of some of the ones that we didn't touch in the presentation here. So I'll let you take it away.
Yeah, I'm just going to real fast rapid fire through some of these questions that were submitted in advance. While Dr. Pfeifer was talking, I was going through, it looks like there's about 44 questions that people have just submitted during our talk. The majority of them have since been answered, and some of them will be answered now. If there's any that I don't go through, then please feel free to reach out after and we'll try to answer them for you. Okay, so one of these questions is about a former boarder who had a senior horse, and this person would see her stretching the horse's legs, pulling the leg forward. Are there any stretches that we recommend either before or after riding? I saw somebody else ask a question about warm up in these older horses that are still being ridden at a competitive level. Leg stretching, especially after an adjustment or adjusting the girth, tail pulls, belly scratches, asking them to lift their belly from sternum all the way back down the midline, engages their core. That's all super helpful for these guys, both while you're grooming them before and after riding. Make sure that you do a proper warm up, whether that's on the lunge line or lots of walking, 5 to 15 minutes before you ask for more under tack. Equiox, we talked about that. Dr. Pfeifer talked about that a little bit during the discussion. It is a little bit safer in the sense that it is a more selective type of non-steroidal anti-inflammatory, but it still comes with its own risks. If you're considering having a horse on Equiox, I definitely would talk to your normal veterinarian about that, especially with your own horse's conditions, and make sure that they don't have anything else going on before we put the horse on it. Kidney levels elevated, we talked about that. Calorie augmentation in the winter for these oldies, especially when they don't have teeth. It's recommended to increase their forage a little bit. I don't think there's a specific volume, but once the temperatures drop below 15 degrees Fahrenheit, you'll have to figure out, those people that are here from Canada and other countries, I saw a few of you, you'll have to figure out what that is Celsius. But once you drop below 15 degrees Fahrenheit, increase their forage a little bit. These guys are hindgut fermenters, so they use that forage in their hindgut as they ferment to stay warm. And we want to make sure that we keep an eye on their body condition and we're not overfeeding to the point of obesity. We don't want an 8 or 9 out of 9 body condition score. Somebody asked about feeding a pony with liver issues and colitis. There are supplements which aid in liver health, such as SAM-E and milk thistle. Both of these cases, though, you should work closely with your vet, because if your horse has liver trouble or colitis, likely there's something else going on. So a blanket statement is not going to help those guys. Talk directly with your veterinarian. What and how do you feed older horses that have lost teeth? Dr. Pfeifer talked about most of that, but the main concern here is that you're feeding multiple meals per day, multiple small meals, as many as you can handle, because if you're feeding 2 meals a day and then the horse is sitting for 10 hours between those meals without bringing food into their gut, they are going to run into gastric ulcers. Also, feeding them half of their 2% daily ration at one time can lead to GI disturbances as well. Think about Thanksgiving meal. You don't want your horse to have a Thanksgiving meal twice a day, every single day. They will definitely cough. My horse is 27, has a few teeth issues. She's not interested in the 5 pounds of alfalfa soaked. What do you recommend? You can try some of those other complete feeds that we mentioned. Also try reducing the volume and feeding more frequently. Try messing with the water content. Of course, you want it wet enough that they're not going to choke. So maybe make it soupy, like Dr. Pfeiffer's patient enjoys. Ways to keep a horse eating. He'll just refuse to eat at times. Man, those picky eaters are tough. When they're picky eaters and they go into their 30s, you just want to bang your head against the wall sometimes. Do make sure that there's not an underlying health related issue. Some horses get pickier as they age no matter what. Sometimes they will eat a senior feed for 4 years and then one day say, I'm done with this. I'm really sick of it. Can you bring me something else? And they'll eat the next feed with gusto for a period of time. Just remember that when you rotate to a new feed, do it over the course of a few weeks so that their microbiome and their gut can get used to it. We had many questions on fecal water syndrome. The approach to this syndrome really depends on the horse. I know you guys have heard that a lot tonight. It's a really crummy answer, but unfortunately for this syndrome, it's really true. The treatment options may involve a change in diet, a change in management, steroids, antibiotics, the addition of psyllium, other supplements, or a combination oftentimes of any of those things that I just mentioned. I suggest working closely with your vet. They'll probably recommend starting with blood work because that will help direct the treatment protocol, and it might be a little bit of a trial and error for fecal water syndrome. PPID horses and grass, we talked about that some. Elderly draft horses, any different than light breeds. I have a 30-year-old that's still in work. Pretty much all of the recommendations are the same. It's just, they're going to require more feed as a whole if you are weighing it out because you have to go by the 1.5 to 2% of body weight. So if they're 1,800 pounds rather than a 1,000-pound animal, you're going to have to increase. Just like feeding senior feeds and hay, you need to increase their dose for bute and banamine. Again, if they're 1,800 pounds, dose them for 1,800 pounds. Your veterinarian will help you with that. So 1 gram of bute might not cut it, but 1.5 might do the trick. When these horses go down, they can be a lot harder to get up. So you need to have a plan to get them up, whether or not you have straps or a tractor or a rescue team around. That's something that you should plan for. On the opposite end of the spectrum, people asked about minis and donkeys. All of the same old equid information applies to these guys. Minis and donkeys love to have dental issues. Minis like to have laminitis. Donkeys love to have white line disease. They like arthritis. They like PPID. So everything still applies to them. Let's see, I think that's all. Yeah, that's the majority of them. Awesome. Dr. Pfeiffer, did you see any others on the Q&A from today that we missed?
Yeah, so it looks like some of the earlier questions about some feeding options, arthritis options, we did touch on there. There were quite a few about when do we consider a horse senior. At least in my opinion, when we're looking at those late teens horses is when we're getting into, kind of that senior territory. And there were a couple quality of life questions. So does a horse owner have to do that alone, or can you do that with your veterinarian? Your veterinarian, 100%. I have many people who call, especially going into the winter, say, hey, can you come out? Let's have a discussion. Can you check over my horse and let me know, give me a quality of life assessment from your professional opinion? 100% okay. Just want to give you guys the tools to be able to do that on your own as well, so you can monitor your horses there. And then there was a question about different euthanasia options. The AAEP does have, and the AVMA, all the organized vet med associations have humane approved ways for humane euthanasia. And one of those is, kind of the one that we're used to with the pentobarbital medication. Pentobarbital, not phenobarbital, very different meds, but pentobarbital IV injection into the horse's vein. But there is one that is becoming a lot more vets are working with, is called intrathecal lidocaine, which basically is lidocaine injection into the nervous system. And this is done under general anesthesia typically. So that is another common option as well. Sorry, just trying to quickly go through these. Does bute affect the heart if used daily? Kidneys are the main, kidney and the gastrointestinal system are what the NSAIDs affect the most. That's not to say it can't affect other organs, but the heart's not typically at the top of the list for ones that we're concerned about. Body condition for recommending for an Arabian. Again, for any horse, we're really looking for that 4 to 6 range. An Arabian, we're probably looking more at the 4 to 5 for a normal for that breed. I don't know if you're seeing any other ones here, Dr. Catalino.
I saw one question about EOTRH affecting lifespan. It does not really affect lifespan. It just affects their quality of life until we manage it. So they should live a happy, healthy life. We just need to change how they eat.
Awesome.
I thought there was a good question about being able to slow down or stop EOTRH if it's caught early. Is that possible, or is it a done deal?
Don't believe there is much in the way of slowing it down. Do you, Dr. Pfeifer? I didn't think so. We just do pain management, and we can change their diet a little bit so that they're a little bit more comfortable as it progresses until it becomes as progressed as we need to remove the incisors. But I don't think there's actually any way to slow down the progression, unfortunately.
And along those same lines, I'm sorry, did I?
Oh, you're fine.
Interrupt?
I was just going to say another thing that I commonly see with those EOTRH patients that Dr. Catalino mentioned, they can be very stoic, but sometimes they will start, just putting their tongue out in between their incisors and using that kind of as a pillow. I see that very commonly in those guys that are starting to show those pain components of that disease.
Along the lines of catching things early or preventing, there was a question about, is there things you can do with a young horse to stave off Cushing's or PPID? Or is that also just basically a genetic mystery? Yeah,
for that one, there's not too much you can do. It's basically just dysfunction of that pituitary gland in the brain. So there's not too many preventative things that you can look for other than trying to catch it early if you're noticing some of those clinical signs and getting them treated. So, we're not working backwards and trying to get their weight back on and trying to get infections under control and that kind of thing.
Any information on EOTRH and selenium?
Ooh, that's not something that I'm well versed in, selenium with EOTRH, but we have some dental specialists that we can talk to, unless Dr. Pfeifer, you have insight on selenium and EOTRH.
No, that's
a great question.
So yeah, I definitely want to look into that, but I don't have any insight to that personally.
I think the important thing to take away with all of this is that the people who showed up tonight you guys are the good ones. You care about your horses. You want to learn more. We love you for that. But make sure you have a good relationship with your veterinarian and work with them. Sometimes trying to go on your own to save a little money actually becomes way more expensive. So work regularly with that veterinarian. So yeah, I think we're going to call it a night. We're sorry if we didn't get to your very specific question, but thank you so much for asking them. Thank you for those who sent your questions in ahead of time. Look at all those hearts going past there. That's great.
Thank you all.
Yeah.
So much engagement. You guys have been great tonight.
Yes, absolutely.
Yes, very good. And Dr. Catalino didn't blow away.
No, the wind started to really pick up here about 10 minutes ago, and I got a little nervous, but here we are.
Well, I'm glad. I hope it doesn't get worse, but I'm glad we made it through.
Me too.
So officially then, thank you so very much, Dr. Catalino and Dr. Pfeifer. This was a great discussion about our aging equine friends. And we want to keep them happy because we do love them and appreciate them. So thank you so much for all of that good information. Thank you, attendees. We loved your participation. You guys were great. And yes, I'll be sending an email tomorrow once I have the video edited and ready to go. And you'll get an email with a link to it. And feel free to share that link with everybody. I saw somebody mention that they were going to share the information with others. Please do. We would love for you to do that. And then again, if you have any other recommendations for webinars that you'd like us to do, send those along to me. I stuck my email address in the chat, and you can get to it from the email that I'll send you tomorrow as well. And thanks to Kevin Hinchman, our IT director. He didn't have to do anything tonight. Yay.
Thank God.
So with that, I'm going to do the very awkward hanging up on everybody. There's no good way to do it, but we'll just say thank you and wave goodbye one more time and see you next year. All right.
Bye, guys.
Bye,
Bye, everyone.
everybody.
Thank you.